Hello, I'm Dr. Israel Barken, the Medical Director of the Prostate Cancer Research and Education Foundation. Every Tuesday, 6 p.m. Pacific Time, we have the weekly Ask Dr. Barken call-in show. During the show, we bring articles that are discussed for the benefit of our listeners. And here is the abstract of one of the articles that we discussed. The name of the article is Androgen Receptor Expression is associated with prostate cancer-specific survival in castrate patients with metastatic disease. This was published in the British Journal of Urology International. Last year it was accepted for publication in May 2009. And when we check here the authors of the article, we see Michael J. Donovan, who happens to be the Chief Scientific Officer of the Aureon company, Aureon Laboratories, and we have here independent researchers from other organizations like Memorial Sloan Kettering and also Yale University School of Medicine and Columbia University. And our share is from Memorial Sloan Kettering. Let's go now to the article itself. Let's talk a second now about the objective. The objective was to investigate whether before treatment, looking at clinical variables and tumor specimen characteristics that included also androgen receptors from patients with castrate-resistant metastatic prostate cancer can be used to predict the time to prostate cancer-specific mortality and overall survival, as androgen receptor levels in prostate cancer have been associated with disease progression, including prostate-specific antigen and recurrence and systemic metastasis. So these materials were obtained from biopsy material on patients known to have metastatic disease, and they try to find out what is the influence of this criteria on survival. So let's talk now about patients and methods. They used hematoxylin and eosin staining for pathology, and they look at outcome data for 104 castrate patients with metastatic disease. The breakdown was 43 patients had prostatectomy and 61 had only needle biopsy material to compare. These are the biopsy materials available on the patients that later on develop metastatic disease. They independently review the morphology as seen by the pathologist and quantitative immunofluorescence to assess the samples. Sections were analyzed for different type of materials here that are listed here in this article. Images were acquired with special imaging software and processed for quantification with immunofluorescent algorithms. What were the results? The median follow-up was 12 years from diagnosis. 49 men, or 47%, had baseline PSA levels of more than 20. These are the people that they picked up in the study to have more significant disease, high-risk disease. 53%, the Gleason sum was 8. 60% died from the disease, and 40% were still alive. The results were that PSA was the only clinical variable associated with outcome. The amount of androgen receptors present within the tumor nuclei, regardless of tissue pathology and primary treatment, the androgen receptor were significantly correlated with greater risk of short time to prostate cancer-specific mortality. There were no, and I'll underline it, there were no H&E or pathological staining that were features that were correlated with mortality. Namely, the glycine itself was not as much correlated with mortality among those that had glycine 8 or higher. The conclusion: increased nuclear androgen receptor expression in either the diagnostic biopsy or radical prostatectomy specimen for patients with advanced disease was associated with reduced time to prostate cancer specific mortality. Thank you for listening. I'm Dr. Israel Barken. We are running the Ask Dr. Barken College show weekly. If you want to join us, you could dial every Tuesday, 6 p.m. Pacific time. Dial the number 1-877-727-3301. If you want to have access to previous shows, you could get on our website www.pcref.org and download on your iPod or to your computer previous shows. Thank you very much for listening. Have a great day. Bye-bye.